Good morning, friends. Myself, Dr. Shomir Boshak, interventional pain physician, and today my topic for discussion is EPM, that is Essential Pain Management. And this is course. Previously, it was offline. Right now, both online and offline courses available, and this is designed for developing all country, for the doctors, for the healthcare workers, for the nursing staff, for those all who attend the patients, inpatients, outpatient in their day-to-day life. Why this course designed? Because in our setup, in our scenario, we don't have proper knowledge about how to manage pain in our day-to-day life, and day-to-day practice we don't know, so we prescribe any medication what we can remember. For this reason, this course is designed by Australian Society, World Federation Society, and International Society for the Study of Pain. With all contribution, this course is designed, and this course is available through all over the world. And you also can learn from this course and get certificate if you registered and go through this website praxhub.com or anzca.edu.eu. There is also scan or QR code. Please, I am going to be slower so that you can do scan the QR code to access the course. I am here to aware all of you about this nice course is available in our website, so that you all know how to manage pain, because we are treating the people, we are some of you attending the patients as a nursing staff, as a doctor, but you don't know how to deal with the patient, how to treat the patient, how to relieve his pain or her pain. So please avail the course and inform of your colleague, batchmate about the course. It is very recently launched in online platform, and the 3rd or 4th September it is launched. This is 3rd September 21 it is launched, and praxhub.com. After entry in the praxhub.com, you should log in, and after this we have to take 2.5 hours to complete the course. After this, there is evaluation form. With this, you will be better doctor, you will be better nursing staff, you will be better healthcare provider for your patients and for the society. Coming to the first part, this is essential pain management, and this comprise of RAT. RAT means recognize, assess, and treat. If you can recognize the patient, you can assess, and then you can treat the patient. So how will we recognize the patient? If we don't know what is pain, what is the definition of pain? As per International Society for the Study of Pain suggested and recommended the definition in 2021, that an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. So this is sensory, emotional, and there is actual or potential tissue damage resembling sometime, because there are few conditions there is no such actual or potential tissue damage. Some key points to be noted. Pain is always a personal experience. If some patient tells you that he or she is in pain, it is we have to accept that he or she is in pain. It is influenced by various biological, psychological, and social factors. And patient report we should respect. Acute pain usually have a helpful role, but chronic pain there is so many agony for the social function, for the psychological well-being. So as a verbal description is only one of the several behavioral expression of the pain. There is some biopsychosocial model which was developed for the pain. Sometimes we are in pain, but in our expression, it is not expressed actually that we are in pain. Sometimes we are not in pain or mild pain, but our expression is aggravated. So this is because of some biopsychosocial model. If psychological belief is strong, attitude about to cope up the pain, emotion and learning is strong, then obviously we will feel lesser pain. And similarly in biological, if neurochemistry, neurobiology, immunogenetic is such a way that our pain generally perceived as lesser degree, lesser amount. Sometimes some social belief, some anxiety, some cultural, socioeconomic status. I am the sole learning member. If I am on pain, if I have low back pain, what will happen to my family? All this leads to impact of the pain. So we should not treat only pain, but also we should address this biopsychosocial model of the pain. Now, few diagram, and can you assess from this diagram are this baby is in pain or not? If it is yes, please comment on the comment box, or if it is no, also comment. Or this young girl is in pain in front of laptop. She is holding her head. So we don't know from this only from behavior that actually he is or she is in pain or not. We should, this child was demanding ice cream, so her mother had not given ice cream. For that she is crying. She is not in pain. And this lady also bad headache due to long technological work like in laptop. So she developed pain, headache, and also lower back pain. So we should ask. Also, in these patients, this lady recently delivered a baby and she is smiling. So this looks, she is not in pain, she is smiling. Actually, this is in moderate degree of pain, but our biopsychosocial response, all this developed no pain at all. She is smiling. So to recognize the pain is always better to ask the person, how are you in pain or not? And there are varieties of assessment tools. So recognize the pain, and many factors are involved, all are important. Why we should treat any patient's pain? Because it is good for the patient, it is good for the family and good for the society. For patients, treating the pain and his or her body return to the normal, sleep normal, blood pressure will be normal, heart rate will go into normal. So chance of any heart disease, if already pre-existing, chance of heart attack will be less, and this list going gradually increasing, and gradually he returned to normal work. This leads to less worry for the family also, and also for the society, less hospital stay, return to the work faster. All this lead to fewer healthcare costs. This is one case and first case. Why we should treat the patient with pain in case it is a case of breast CA, 44-year-old Maria, cancer patient. She is living in a large city. She is married with two children aged 11 and 8 years. She has advanced uterine cervical CA. She is spread towards spine and pelvis. She had maximum treatment of her cancer, but now she complains of new low back pain, pelvic and left leg pain. Why should we treat her pain? You can answer or forward. Because first, it is a ethical and human practice to treat the pain. It will reduce her suffering. It will reduce her anxiety. It will improve her sleep and appetite. And it will reduce the family stress for the husband and for the children. Next, come to the second case. This old man, after post-operative period, he is complaining of pain. Daniel, 74-year-old post-operative patient, just undergone laparotomy for bowel obstruction, and when you meet him surgical ward as soon after operation, he complaining of severe pain. So why should we treat his pain? Similarly, because it is a ethical and human practice, it will increase the comfort for the patient. It will reduce the heart rate and blood pressure. It is a risk factor for heart complication as heart attack. And it will improve the patient ability to sit up in the bed and take deep breath. Therefore, chest complication like infection will be reduced and early discharge will happen for this patient. It will improve the also mobility and reduce the risk of deep vein thrombosis. So there are, by treating pain, you will not only treat the pain, but also as a holistic way, you treat multidimensionally and multidisciplinary mode. Now in case 3, this 7-year-old boy, also in post-operative period, he is in pain, but his verbal expression is not at that much of that he is in pain. 7-year-old post-operative patient just undergo laparotomy to remove a perforated appendix which caused peritonitis, but his facial expression is not as much. When you ask him, he described about severe pain. So why should you treat Tommy's pain? Because similarly, it is a ethical and human practice. It will provide comfort for the patient. It will reduce the fear and stress, and it will improve her ability to sit up in the bed and take deep breath, reduce the risk of chest infection, and also for the parents, for the society, it will give peace of the mind. Next, come to case 4. This old man undergone an amputation surgery. John, 50-year-old man, amputation surgery undergone 1 year back because of motor vehicle crash and undergone below knee amputation. He comes to your clinic. It is an outdoor patient and complaining of pain in his absent foot. In his absent, So why should you treat joint pain? Because it is ethical and human practice. It will improve the comfort. It may improve the sleep, emotional well-being. He may be the only earning member. It is a good for the society to return some kind of work, and for the hospital it may be more efficient for the hospital. So we should treat pain because it is good for the patient. Early return to work or school, it is good for the family, less burden, less headache for the family. It is a good for the society. Early return to work, out of hospital, and more efficient for the health system. So, and also it is the human thing. I will come to assessment section on next episode. Okay, if you like this video, please comment, like and share, and please forward this video to your friends, colleagues, among all the healthcare workers, because it is developed for you and you only. Essential pain management, and this is a September pain awareness month. Feel free to contact with any type of pain, back pain, any kind of issue. I am here. Thank you. Good morning. Bye bye.